plans for the downtown detention center.
Motion.
All right.
Seconded.
It's been moved and properly seconded. All those in favor?
Aye.
Anyone opposed? All right. We have approved it. All right, let's go to a late resolution from Councilman Taylor. Approves an amendment to the lease agreement between the Metro Nashville Police Department and Signature Center LP for office space for the Police Advocacy Support Services PASS program. Do I have a motion?
So moved.
All right, Councilman Taylor, would you
thank you.
speak to this?
There's a clerical error in the application. Lieutenant Cantrell can speak more to what the program is.
Essentially, the program oversees the mental health and well-being of the police department, fire department. They will respond out during officer-involved shootings or other traumatic incidents to support the officers that are involved to ensure that they are taken care of so that they can continue to have positive interactions with the community. They've been in that space, I believe, since 1996 without any additional room to grow. And they have since the last, I believe 2020, added about 9 people to that division or that area, so they've needed additional space to enable to continue to guarantee the same confidentiality that is inherent in counseling services and stuff like that.
All right, any discussion?
One last thing, I mean, so the lease is up, the reason it's late filed, it's in my district, the lease is up last month, and we're now in this new month, and so we wanted to late file to make sure that we can keep them in their home.
All right, very
So,
good.
renewing those.
All right, it's been moved and seconded. All those in favor?
Aye.
Anyone opposed? All right, thank you very much. This has been recommended for approval. Well, Dr. Wright, I sent you a couple questions. I'd like to probably start with Metro Animal Control since Councilman Bradford's here and it's in his district. And so I had just sent Tom Sharp after our last committee meeting just some questions, and Tom is on vacation this week. So Dr. Wright is pinch hitting with
Does a much better job than I do.
with feedback. And so one of the things that I'd sent was Metro Animal Care and Control is under some stress lately, and we probably all recognized it in our districts, and just wanted Dr. Wright to speak to what's happening.
So, we had Lauren, who was the director, left in August, I believe it was. We have identified a new director, actually came up through the animal control officer side. Since naming her, we've actually stabilized in that we haven't lost any staff. Having a lot of turnover, they're low-paying positions, and it's hard work. And so it has been difficult. Of course, with this current market, it's hard to get people. I think that will improve as the mayor's budget, if it gets approved with $18 an hour, it will affect some of our entry-level positions and boost that up. The other thing we get is 3 additional animal control officers in the budget, as well as vehicles for them. And it's important to have the vehicles because they can't do a lot without the vehicles. So that will help. There was Dennis Ferrier did an article, probably will be one next week. And really, as it was really just stating our current policies and practice. If we get a call for a animal at large, unless somebody can kind of confine it, 90% of the time, by the time we get there, it's wandered off, and so we can use those officers in other ways for calls where they're actually going to have an interaction and such. So, and we're stressed as far as just having positions filled, so that's how we're trying to handle it for the moment. But I think as we move forward with the changes, I think that will help a lot. And I am very happy that we have at least stabilized and not been losing people, so that now we can actually grow the positions and fill the positions that are open, because we do have a fair number of openings.
Yeah.
And even on the kennel side, so not just the animal control officers, kennel people are one of our hardest to keep, to get and keep. And so there are some positions even in the budget for that too.
Yeah, and I guess I know on how the positions are stressful for the employees, because you're dealing with people's pets and you're dealing with the emotion of, potential of euthanasia and things of that nature. Are you able to speak to the how has the standard of care potentially changed? Has there been a change with the impact to the community as far as like, because I will say, I will go out if a resident can't catch a dog. I've been out there and caught dogs. I've fostered cats, for animal control, everything. And so, can you speak to like what's different? Because I know the not coming out unless the animal's contained, that's been a practice for a while. Is that being kind of exacerbated with the challenges that
I
you're
don't
seeing?
think it's being exacerbated. I think that we're trying to maintain all of those services and the level that we've had on a staff that's short. So it is stressful for them, and they are working some extra hours and that type of thing. We have had some changes in the hours that we are open to the public to help balance some of that other piece of being out in the community to do some of the things in that nature. But as far as the overall care goes of the animals, they're getting good care, but we're not able to interact with the public and have open time as much because we're busy taking care of the animals.
Right. Let me take some committee member questions first, and then Councilman Bradford, I'll come to you. Councilwoman Johnson.
I'll let her, Council Lady Porterfield go because she had her hand up first.
Okay, Councilwoman Porterfield.
Thank you so much, and thank you for what you all do. This issue is a little more new on my radar. I became a pet mom about 2 weeks ago and went to Metro Animal Control. I had a great experience. We adopted a 6-year-old pit bull and a 10-week-old kitten. And everyone there was just very kind. It was a wonderful experience. But you could see the level of stress. And there were just amazing volunteers, but they were just stretched so thin and barely able to, it seemed as though they were barely able to meet the needs of and this is from the kennel side, making sure that the dogs are walked and making sure everybody's clean and healthy. So it's definitely, and of course there are like the limited number of hours, the inability to kind of respond to some of those emails of, people inquiring about adoption because they are stretched so thin. So everyone was absolutely wonderful, but it is just evident that they are stretched so thin. So can you speak a little bit about, I know you said that in the budget you're looking at some more positions. Are y'all also, and I know of course like with the mayor's potential pay raise, because after the story broke, I had someone to reach out to me that was interested, but when they saw that the pay for the people that are, helping with the animals, I think it was like $16 or $16.75 or something. And once they saw the pay, they just couldn't do it, especially with it being more of a part-time position in nature because the shelter's open in such a limited capacity.
Right. So you're exactly right. They are very stressed. And we are depending a lot on volunteers to help us. And they've been great in that regard. I came from a background where my dad was a veterinarian. We had animals around the house all the time and out at his office and such. So, it's a lot of work and it's stressful. I think the $18 an hour, we're actually looking at, we've got a Kennel 1 and a Kennel 2, and actually kind of putting those together into a single and being able to probably raise the rate even maybe a little bit above 18, that minimum. So unfortunately, we don't keep many people that get to the level where they're even a 2, just because the turnover has been high. And I do think that there was some issue with the prior director that led to some of that. Some of it's COVID, some of it's the environment right now. But I do think that, like I say, it's stabilized. I do know that we've got 2 or 3 more people in process with start dates. I know one is there through everything, and we're just waiting on a start date. It's probably within the next week or 2, and we've got at least 2 others that are have been offered, and so we're making progress. It's just, it always just takes a while to get them. But I do feel, and Hugh Atkins, who's the bureau director for that area, is out there at least 1 day a week, and a lot of times more, trying to help support them. Other staff's out there trying to help them support them also.
Yeah, and I apologize. I'd really like to skip to, I think, Councilman Bradford, if I can, just because I know you've got your committee to go to, so I'll jump ahead to you if that's okay.
I appreciate you taking the time to recognize me, even though I'm on the committee. So my questions, you kind of started leading into it. Went out there, I've had conversations with Ashley and with the staff out there. And, you hit the nail on the head. They're stressed, they feel like they're overworked. Their concerns and issues with getting people hired is, they say the time from when the job is offered to the time they start. They're having issues getting people, like, there's one individual, they said it's taken almost 2 months for them to get started because of some of the HR and some of the physical stuff they have to go through. So can you kind of talk about the process of
Right.
once someone's hired to how quickly they can start?
Right. We do require background, so that's one thing that has to be done. We do, at least for the animal control officers, they would be considered job sensitive positions, and so they may have to have a drug screen. Our kennels don't, so that may slow them down. And then the other thing that we're getting staff for is our Occupational Health and Wellness Clinic. We're getting 2 LPNs because there's a lot of turnover within Metro, and we're doing all those physicals for police and fire and ourselves, and so that is a thing. But we also have got an agreement that we're just getting in place, working with HR, Central HR, with the IOD clinic staff, which is staffed by Concentra, to help take some of that load, to help move that forward more quickly also.
That was gonna be my next question, was if there's any
Yep.
third-party vendors that we can try to
Yep.
use.
Yeah, we've already got that in place, and working through that and just figuring out, because it's and the other thing was, we did for a little while have a temporary nurse practitioner. We've got our full-time nurse practitioner back. She was on maternity leave, and so she just came back. Problem with that is it takes a little while to get them up to speed and all of that, but now she's back and going full-time again, so.
I just have one follow-up,
Okay.
if you may.
Go for it.
So it's great hearing that we're putting 3 more officers in this budget. My question is, those 3 positions, are those new positions, or are those just getting us closer to where we need to be? Like, what number are we at now? What would be fully staffed, and what would be optimal?
Right. So those would be additional positions over what we currently have. And it really would depend on how and what council and community wants for our animal care and control to really do. I mean, we can do a lot. This will help us move us forward, but it's not going to be probably even right now with what we're tasked with quite there. I think the bigger piece, though, over the animal control officers is really going to be the kennel staff, and we're down more on them. The 3 additional positions we've got will help also. But if I can't even keep those filled, 3 extras don't help me, because I haven't even been able to keep those filled all the time. So we keep looking, keep recruiting. I think the biggest thing, though, is as Councilman Porterfield said, that the amount that the pay was,
Yeah.
it is hard, you know.
Let me go to Councilwoman Johnston, please.
I've had issues in my Paragon Mills neighborhood where we have aggressive dogs that are out, and so I don't want constituents out there trying to catch an aggressive dog, but they're attacking other dogs, they're attacking other people, and I know you're shorthanded. I mean, what are we doing outside of waiting to hire people, right? Because that's dangerous. And then also, once you find an animal that has been aggressive, that has attacked another animal or attacked a human being, what is your policy?
So we have to follow the current law, and one of the things is that they're real property. An animal is real property. We can't just go take them and impound them and keep them without them going through court process and all of that. But I know that Councilmember Stiles is working on, and we need to update our vicious or aggressive dog policy. So that piece is, I think, important. It's just that with some of the impoundments that could go on with that, we could hold a dog or an animal for months till it's determined in court what to do with that dog. Not saying it's wrong, just saying that then puts further demands on needing more staff, needing
Sure.
more space, and all of that. So it's an expensive endeavor, but it's something we can definitely do if that's the decision of council,
I would hope we would all be in agreement that we want more versus less in that regard, but I guess that's a debate for another day.
All right, Councilwoman Gamble.
And mine is kind of a follow-up, thank you, Chair. Will the new position, the officer positions you mentioned, will they handle investigations such as when you get complaints about?
I believe that they
Issues with
will. I mean, the
irresponsible
nice thing about having Ashley now as the director, she came up on the animal care, the control side. So she's very aware, and she's already looking at, and I know on Wednesday, and I haven't had a debrief, but I know that Hugh and her had a discussion about how they could do things, even now, to change how they're able to respond and what they're able to respond to. So I do expect that. Give us a little bit of time to get updated, and we can probably give you a better answer.
Councilman Nash, or was it, I think I saw your hand.
Just quick, you see several documentaries where prisoners work with animals, kind of a relation, they help the animals help them. Are we doing anything like that?
The sheriff in the past has had a program, I believe, with dogs.
Called Second Chances.
Second chances, yeah. And so there is that program. I don't know what its current status is. I know that they have had it. A lot of things changed during COVID, so I'm just not sure, what they've done with that. And they didn't have as many people in jail, and whether they could take care of them and all that, I just don't know.
Okay.
But yeah, there is something that's been considered and done previously.
Councilman Swope.
Just for the record, what is our official coyote policy?
I don't know. I'd have to go look at it.
I know. Every time I ask, I get the same answer.
Yeah.
It is a problem in my district.
Yeah.
3 or 4 times a year, I got a coyote sitting in my backyard trying to chew up the neighbor's dogs or my own.
Right.
And I've made the phone calls and have gotten zero response from this, so we've kind of dealt with it on a local level. What would you normally do if I called you with a coyote in the backyard?
Yeah, if we could get out there and capture, we would.
Yeah, usually it's gone by then.
It's usually gone. Usually by the time you've made the call, a lot of times
That's
it's
exactly
gone.
right.
So, I don't know that, other than locally doing some trapping or something else, I'd
There's
have to look
alternatives.
into that. There are alternatives, sure.
Good, just wanted it official, thank you.
Any other questions about this issue? All right, I appreciate you answering so many questions that we've
That's okay.
gotten.
Glad to.
And then, let's skip over and talk about, well, first of all, I guess in the last committee meeting, so I asked Tom Sharp, I was like, you got anything to share with us? And then he gave us some COVID stats, and then the next day you all announced, 20th Avenue's closing. So I guess I understand why it's closing, and I don't disagree with why it's closing, but I guess I just want to understand, are we going to have a conversation like when Murfreesboro Road, when we get to that point?
I think the reason was that OEM's in charge of those, and they hadn't finalized the actual statement, okay?
Okay.
So while we advise and we help with that, and we kind of knew it was coming, we were trying to wait till the last minute to know for sure that it was the right thing to do, to close it. It's the first place. I will tell you that right now, the plan would be to keep Murfreesboro till the end of this fiscal year, so at least till the end of June. The state funding is running out for that. Now, if council decides, if somebody decides that we should keep it, there's funding for it. I think it stresses my staff a little bit, stresses OEM, and stresses obviously Meharry. We're all willing to do it if it's the right thing to do.
Okay.
But right now, I look today, this week, we've had 74 people on Monday and Tuesday and 44 yesterday.
Yeah.
And test.
Right.
And I would say, what I'm hearing from them is most of those are people that are testing because they're going someplace out of the country.
Yeah.
So there are a lot of other places they could go and get that testing done and on their own dime instead of ours at $100 a test.
Yeah, that makes sense. Okay,
So-
that's cool. I wanted to ask that question. And then the,
Really quick question.
You got a question?
oh yeah, go ahead.
Really brief.
Sure.
What's the turnaround time now if someone were to go to the Murfreesboro Road site to get tested?
24 hours for the most part.
Okay,
We should have it the next day.
okay.
we're just, I mean, when you're only doing 75 and at one point we were doing thousands a day, there's a lot of capacity that's not being used.
Go ahead, Councilman Gamble.
Are the drugstores still doing testing?
Drugstores are still doing testing. A lot of the urgent cares are doing testing. Obviously, the hospitals are doing testing. There's all the home testing that's available now, and you can get reimbursed even from a lot of the insurance carriers. So there's a lot of capability to do testing.
But the PCR test?
But the PCR test is going to be a medical provider that does it.
And then, any other questions about COVID testing? Because I know Leslie had sent us the email saying that the reporting was changing some. Can you speak to
The
that?
state changed their reporting, and they're trying to move COVID, as we would expect from pandemic emergency response, to surveillance. So we've known for a while that the number of active cases wasn't really truly reflective of active cases, but we continued until the state stopped providing that data to give people at least some idea. Early, we knew, with the very early variant, we knew it was 10 days, and that you knew that you were gonna get, 14 days, and most people were gonna be about 5 days in from their exposure. Well, now, it's as quick as 1 to 2 days that you can become positive. So by the time we hear and can get a hold of, they're already done, and the other thing is not everybody's lasting 10 days. We've got a lot of them that tested after 5 and they're negative, which means they're no longer infectious. So we just had, by its nature, put 10 days in the database. And so when that went away from the state level, we thought it's time to just follow that, because we've known it's been kind of, it just didn't, for us, it wasn't serving any purpose anymore.
Right, makes sense. And then, the only other thing I wanted to ask about was Partners in Care.
Partners in
Because
Care.
you just had the quarterly results, and
Yeah,
I attended
and there's
this
a
morning.
meeting, was today?
It was this morning, yeah.
Yeah, this morning.
Yeah.
I was not available, unfortunately, for that, but yes. It seems to be doing really well. We are rolling out, working on rolling it out to 2 more precincts this year, and it's scheduled to roll out at that rate for the next several years till we're in all the precincts. Police department's deciding where's the best places to go. I believe Southeast and downtown are gonna be the next 2. The biggest challenge, I think, for it's going to be just finding the mental health providers. Mental health is tough. And I know just because of having been on the civil service, or on the benefit board and reporting to them, mental health issues a lot of times takes a month or more for people to get in and get seen. And so it's just short. And so we've got to figure out a way, long-term, to try and build those numbers here. And we're thinking about that from the health department. We're doing some things with community health workers. I've got a grant, a couple grants actually, see how those work. But then the thought is to build that program where we take those that are lay trained and then move them, and through training and stuff, help them get to where they're ready to go, maybe on for an advanced type of degree, to do nursing or to do mental health or something else, and have a pathway there for them. But they are seen as being very beneficial to communities, particularly our underserved communities across the nation. So we're looking at all of that.
Yeah, and I noticed before we came in here that the results information wasn't posted yet. I guess we'll probably get an email. I have a paper copy, but we'll get an email about it.
You'll get it, and you should get that report shortly.
Okay, very good.
Sure.
All right, anybody have any other questions for Dr. Ray? All right, I hope Tom enjoyed his vacation. He
I
missed all
hope he
the
did
fun.
too. I think
All right,
he's in
we're
New
adjourned.
Orleans.
Yeah.
Yeah.
Dr. Wright, I have a